a program by, for, and about women today with Sandra Elkin.
Good evening. Tonight our topic is DES and DES daughters. With me this evening is Kay Weiss. Kay is a health researcher who has specialized in areas that concern women. For several years she has concentrated her efforts on analyzing the present vaginal cancer epidemic and the DES drug that caused it. She has been a research associate on several DES projects and a research associate at the National Heart Center at Baylor Medical School. Kay, thank you for coming.
You're welcome.
What do people mean when they say DES daughters?
Well, DES daughters are a group of young women, young girls really, between the ages of, 0 or 1 really, and 35, who were exposed when they were in their mother's uteruses to a synthetic estrogen called DES.
What was DES used for? I mean, why were these women given DES?
DES was very widely prescribed in this country between 1940 and 1971 to prevent miscarriage and other complications of pregnancy, such as diabetes, toxemia. It was even given to women who had been infertile and had had difficulty in becoming pregnant. So these are the women who, 6 million women in fact, were prescribed this drug between 1940 and 1971, and about 3 million of them had daughters and about 3 million had sons.
So in other words, most women who read about the DES vaginal cancer epidemic read and say to themselves, well, I was not in danger of having a miscarriage and probably I didn't have DES. Is that a safe assumption for them to make?
Well, no, it isn't, because many obstetricians gave DES or other synthetic estrogens. By the way, that 6 million figure includes women who were given not DES but other kinds of estrogens, both synthetic and natural as well, and we're grouping them with the DES mothers. Many obstetricians gave DES and other estrogens simply for prenatal care to pregnant women who had no history of miscarriage or spotting or bleeding and no indication that they would be suffering any complications or risks during pregnancy. So really any woman who was born between the years of 1940 and 1971 and on up to the present really, but I think maybe we can talk a little bit later about how the drug is still being used in some isolated pockets of the country. Any women who were born during that period of time really should try and check their mother's medical records and have special tests to determine whether or not they were exposed to DES in utero.
We can talk more specifically in a few minutes about how you go about checking
Sure.
back. But I'd like to know about the epidemic. I mean, it's called an epidemic, but didn't it started with a very few women, actually.
Yes, in 1971, 8 cases of a very rare kind of cancer came to our attention. Previously, almost unknown kind of cancer in young women called vaginal or cervical clear cell adenocarcinoma. And this is quite a different kind of cancer from the more common kind of squamous cancer of the cervix that we're very familiar with in our population. This clear cell adenocarcinoma has a tendency to metastasize early, and its fatality rate is higher than the more common kind of squamous cancer. So it's a much more lethal kind of cancer.
And had it not been seen before 1971? Or?
Well, there were so few cases reported in the world literature, I think maybe less than 5, and these were in old women. So indeed, the appearance of this tumor in young girls, some as young as 7 years old and on up through the adolescent years, because that's when the cancer comes to express itself, is during puberty and during young adulthood. But the appearance of these first 8 cases in Boston at Massachusetts General Hospital comprised an epidemic really on their own, but because they were such an unusual occurrence in such young women. But now we have about 300 cases of this previously rare, unique kind of tumor, which have been reported to the Registry of Clear Cell Adenocarcinoma of the genital tract in young women, which is now housed at the University of Chicago. We have varying quality of data on these cases. Not all of them have had a documented history of exposure to DES or synthetic estrogen in utero, but about 85% of them have that documented history, and so it appears indeed that DES is the cause of these cancers. Now, why do we only have 300 cases when nearly 3 million, the actual estimates are between 1 and 3 million daughters have been born of these pregnancies? Well, not all of these daughters have reached puberty yet. Many of them are much younger than puberty. And of course, there's the problem of underreporting from physicians. We don't have mandatory reporting laws in this country. So we really have no idea how many cases of this rare kind of vaginal cancer there are in the country.
The epidemic in itself was unique in terms of public health happenings.
Yes, because it was the first time, it represented two unique occurrences in the field of public health. It was the first time that we've seen a demonstration that cancer can be caused in the fetus by drugs taken by the mother during pregnancy, and also this is the first drug-induced cancer epidemic in young girls.
Are there symptoms so that, for instance, you know, if you're totally unaware of this possibility, the possibility of your mother having taken DES during pregnancy, when you go to a physician would pick up these symptoms?
Unfortunately, the cancer is asymptomatic in probably over half the cases, and it's hard to diagnose. It's very difficult to detect. A routine gynecological test will not necessarily pick it up.
So it's not a matter of having access to good medical care?
No.
Really?
In fact, a certain kind of test has to be given, but I think maybe we should talk about that after we talk about adenosis a little bit. In addition to these 300 or so cases of this rare kind of cancer which exist in DES daughters, virtually all DES daughters, that is virtually 100% of them, are thought to have vaginal adenosis or cervical erosion, which are really the same thing. It's glandular tissue which is on the cervix or the vagina, which doesn't ordinarily belong there. It would be as if the inside of the mouth was growing out onto the face. It's tissue which ordinarily exists only around the cervical os in normal women. But in DES daughters, in daughters who were exposed to estrogen in utero, it spreads all over the entire cervix and even down into the vagina. So vaginal adenosis is thought to be benign. There is a possibility that it could turn out to be a precancerous type of condition, but right now, on the basis of studies of the DES daughters that have been followed to date, it is thought to be a benign condition, which is fortunate.
Well, if you have a diagnosed case of vaginal adenosis, does it follow that you will have adenocarcinoma?
No, not at all. The vast, vast majority of women who have vaginal adenosis never develop adenocarcinoma. So as I was saying, it is thought to be a benign condition. However, there is some indication that another kind of cancer, carcinoma in situ, squamous cancer, may come to light in these daughters as they become much older, as they get into their 60s and 70s.
Are there symptoms for that?
Well, basically, there are few symptoms connected with any kind of genital cancer like that. It's something that has to be picked up on a cytological smear or a biopsy. Now, about 30% of DES daughters, in addition to the cancer that we've talked about in the vaginal adenosis or cervical erosion, about 30% of them have structural or anatomical abnormalities around the vagina and cervix, usually called transcervical ridges or something like that.
Now, can these be picked up by a private physician?
Those are visible, yes. Those are visible, readily observable during a gynecological exam, but the adenosis is not and the cancer is not. So you have far less than half of the DES daughters with conditions that can be actually seen by the doctor or seen by the individual or felt.
If one finds this condition that you just described, a physician should then look further, right? Almost automatically.
Yes, a physician, unfortunately, many or most of the DES daughters who have tried to access the medical care system to get testing for vaginal cancer or adenosis have been offered the routine gynecological pap smear, which is usually taken from the cervix, you know. Well, that doesn't test for vaginal cancer, and it doesn't test for vaginal or cervical adenosis or erosion. It's necessary to do an iodine stain test wherein the vagina and cervix is coated with iodine, and certain areas that may be glandular in origin, that may be glandular tissue, don't take the stain. These are the areas then that must be biopsied, or preferably, if the physician has a colposcope, should be looked at through the colposcope. The colposcope is a light and a microscope, a microscopic lens, and you're able to view through several layers of tissue. So this is what needs to be done, rather than just getting the routine pelvic.
Can any physician, will any physician have a colposcope?
Well, there are few colposcopes in the country, and even fewer trained colposcopists. It's difficult to interpret the results of these colposcopes, and one thing that we're concerned about is that those physicians who do have them or are trying to gain access to them might misinterpret the material that they see through it, and this might lead to erroneous treatment. Now, one thing a physician can do in the office is the regular pap smear, the cytological smear, but if it is taken from all 4 vaginal walls and the inside of the cervix and the outside of the cervix, and placed on 6 separate slides, what we call the 4-quadrant pap smear, that is an adequate test for the cancer, not for the adenosis. The only thing that will pick up the adenosis is the Schiller iodine stain test.
So run down again what people should ask for if they suspect they might have this condition.
Well, they should ask for the iodine stain test, and they should ask for that pap smear, which is taken from all areas of the vagina and cervix, which it is, of course, not usually done, you know. They should get a colposcopic exam if they're able to. But unfortunately, as I said, this is a pretty rare thing right now.
Now, I've heard that some physicians are suggesting cauterization for adenosis.
Well, yes, I've heard that some physicians are doing partial vaginectomies for benign adenosis, and cauterization and cryotherapy, cryosurgery, and what have you. It's not generally being recommended in the medical literature. There is no treatment that is necessary for adenosis. Adenosis is a pretty benign condition. It's quite harmless as it exists. I think it's unwise to treat it with any kind of treatment at all, let alone such aggressive measures as trying to remove it. Now, adenosis is asymptomatic in the vast majority of cases, but if there is excess mucus discharge or vaginal bleeding, then some kind of treatment like acidification of the vagina or progesterone vaginal suppositories or some of those experimental kinds of treatments, if a woman wants to have them, she might consider those. Now, there is a danger, too, with the irregular vaginal bleeding that some DES daughters have experienced, those few who do have symptoms, that this might be mistaken by their gynecologist as a symptom of a menstrual irregularity or what have you, and possibly even treated with oral contraceptives. This is the traditional way that is being treated today. And this, of course, is very dangerous to give more estrogen hormone to these women, because there's always a possibility that the adenosis or the latent undiagnosed cancer could be exacerbated.
Some mothers were, you know, on hearing about this, some mothers who took DES were relieved somewhat because they took very small doses for a short period of time. What effect? Does it matter when you took it, how much you took it, or for how long you took it? What about that?
What matters is when during pregnancy you took it. For harm to have been done to the developing fetal cervix and vagina, the mother had to have taken the estrogen sometime between the 7th and the 18th week of pregnancy. The dosage and the actual duration that she took the drug don't seem to be nearly as important, because we've seen cases of vaginal cancer in daughters of women who took very, very small doses, and we've seen cases in women who took DES for a very short period of time, a period of days or a week perhaps. So the important thing is that women who know that their mother took the drug sometime between the 7th and 18th week of gestation ought to get the tests.
What about the, you know, how do you find out?
Well, it's been very difficult. DES daughters and their mothers have been frustrated, I think, at nearly every turn in trying to find out whether or not they were exposed to the drug.
Can't you just write to your hospital or to your physician if you've moved or whatever?
You can. Many of the hospitals are either unwilling to send people their medical records or are too understaffed to do it. I think it's probably the former. Many of the obstetricians that women try to call and ask, well, did you prescribe DES to me, are either dead or they have destroyed their records or don't have their records. It's really been very difficult for some women to find out whether or not they were exposed, and it's been equally as difficult after finding out to find a gynecologist who is familiar enough with the problem to recognize it and to do the proper kinds of tests, and who knows how to interpret the results.
Is there a rule of thumb, for instance, if you were pregnant, if you had toxemia, if you had some other problems, can you assume that you probably had it?
Yes, particularly during the peak periods of use in the 1950s. But again, I don't want to restrict it to the 1950s because it was widely used in the 1960s and to a lesser extent on up to the present. And of course in the 40s. But if a woman and her mother are unable to find out from the records whether or not the woman was prescribed it, then indeed, if the woman was known to have a history of miscarriage, there's a great chance that she was prescribed it.
Is there a government agency or someone responsible for calling these women and saying, or in some way being in touch with them and saying, there is a potential problem, you should go to a physician?
Well, this hasn't been done on a large scale to date. There have been small localized efforts. The National Cancer Institute has 4 centers in the country that are attempting to contact some of these daughters and provide them testing and treatment. But the fact is that of the estimated 1 to 3 million DES or estrogen daughters, a substantial percentage of them have not been recalled and contacted. Probably the vast majority of these women have never even heard the term DES daughter and don't know anything about it. So unfortunately there are no public health agencies or federal health agencies under whose mandate it comes to do something like this in the case of
So we have no
a
provision
chronic
in our
disease
healthcare system
epidemic.
at all for this kind of thing?
No, we have the Center for Disease Control in Atlanta, but they mainly deal with infectious disease epidemics. This chronic disease epidemics are a new phenomenon almost, especially in iatrogenic disease like this, which was caused by treatment, by medical treatment, by physicians. It's really not within the mandate of any existing federal agency to take it upon themselves to recall 3 million individuals, and it's up to obstetricians if they want to do it, if they want to research their records and do it themselves. There's no law requiring it. I think it's a shame, and I think that, you know, after all, we have laws that require automobile manufacturers to recall millions of vehicles when a defect is even suspected, let alone proven by cause and effect that is going to result, and they have to do this at their own expense. I feel that the manufacturers of DES, there were some 200 firms manufacturing it in this country, ought to be required, maybe some kind of new legislation ought to be introduced, and they ought to be required to trace down the victims of this drug, which was, after all, marketed in the absence of sufficient safety and efficacy testing.
One of the things that I've read little bits and squibs about, not nearly as much as about DES daughters, is sons of women who took DES during pregnancy. Is there a problem there, or what exactly is the story with DES sons?
Well, there's some very preliminary evidence coming out right now. There hasn't been a large group followed so far. Probably less than 200 DES sons have been followed and tested, and it appears that probably about 20 or 25% of DES sons, on the basis of these studies, might be expected to develop, not cancer, because that hasn't been seen, but urogenital tract problems, trouble passing urine, a narrowing of the urethral passage, testicular abnormalities, cysts in the epididymis, These, once again, are by and large pretty harmless, pretty benign, and they are asymptomatic. They have to be looked for.
Is there any evidence of infertility?
Yes, there, once again, about 20 or 25% on the basis of these very preliminary studies indicate that there is a lower sperm count and some sperm abnormalities, and that there may be a decreased chance of these males being able to father a child. I don't know. The studies are very, very inadequate right now. I think it's interesting to point out that the anti-miscarriage drug, as it is called, was not even effective in preventing miscarriage.
You mean all of these women were given DES to prevent miscarriages and DES did not prevent miscarriages?
Well, yes, that's exactly what I mean. It came into use in the 40s on the basis of a few studies which indicated that it might reduce the complications of pregnancy, but in the late 40s and the 1950s, 3 well-controlled scientific studies were published in the medical literature proving that the drug was useless in prevention of miscarriage and other complications of pregnancy.
Didn't anyone read that?
Well, I don't know. I think the use tapered off a little bit after that, but not too much, because between 1960 and 1970 there were about 50,000 prescriptions, 50,000 pregnancies a year were being subjected to this.
It's just, you know, it seems like an incredible scandal. One wonders, why isn't there more of a furor over it? Why isn't, you know, why aren't more people angry? Why are women sitting still for this?
Well, I think if it pans out that there are going to be effects seen in the males, then you will see more public health action taken about the females.
How can one tell whether one is getting DES now?
Well, it's difficult even to tell. I meant to mention, when you're looking at the old obstetrical record to try and figure out whether you were prescribed it, DES alone was marketed under 70 different brand names. I've heard of cases where physicians sat down and looked at the record and thought, no, I didn't give her DES, and it turned out later that he had. That's DES alone. The other synthetic estrogens and natural estrogens, which were also given for anti-miscarriage use, were marketed under about a total of 200 brand names. So it's difficult.
Can you compare DES to the other estrogens and their ability to cause side effects, and what are the similarities?
Well, we don't have any cases on record of vaginal cancer in the daughters of women who were given other estrogens. I don't know why that is. I suspect it might be because of underreporting. The fact is that many endocrinologists, there is a dispute, and some endocrinologists and oncologists feel that there was something particularly carcinogenic about the DES form of estrogen. Others say, no, all estrogens have the same effect on metabolic and biochemical systems, have the same effect on cancer-causing systems, and have exactly the same carcinogenic potential.
I think most people who've heard of DES have heard of DES in cattle feed rather than, you know, what's going on in human beings at the moment.
Yes, DES has been used as an additive to cattle feed to fatten beef quicker for several decades, and as you probably know, because you've been reading about it in the paper for several decades, people have been trying to get the FDA to ban it from its use in cattle feed because they knew that it was a cancer-causing agent because of its testing in laboratory animals. The FDA was never able to do this because there was no human clinical evidence that DES was a cancer causer in humans. It's pretty easy to get laboratory animal evidence that one agent or another is cancer causing. It's very difficult to get the human evidence. But in 1971, when the first few cases of vaginal cancer came to light and Dr. Herbst connected them up with DES, these consumer groups and lobbyists had a new tack now, and they were able to get the FDA to ban DES from cattle feed. But ironically, in spite of the fact that women had provided this necessary human evidence about DES being a carcinogen, the FDA approved a new DES drug for women, the morning after pill contraceptive, which contains about 833,000 times the amount of DES that had been banned as unfit for human consumption in a serving of beef liver.
I want to save the morning after pill. You come back next week and we'll talk some more.
Okay.
But in the meantime, what's being done to prevent another epidemic like this?
Well, unfortunately, there are really no mechanisms inherent in our legal system or our medical system to prevent
Well,
it.
are you implying that maybe we'll have another epidemic with this morning after pill?
Well, there's no evidence that the morning after pill is going to cause cancer in anyone, but neither was there that the anti-miscarriage drug was going to. As with all of the uses of estrogens, estrogens are known to be carcinogenic in laboratory animals, and there is some human evidence coming out now too. I think to prescribe estrogens as widely to the American female population as we have been doing is playing with fire. And unfortunately, the laws which require that drugs be proven safe and effective before the FDA grant them approval for manufacture, such as with the new morning after pill, don't take into effect the latency period that has to elapse before cancer can be expressed.
How long is that about?
Well, that can be 20 years. And we do have the Harris-Kefauver Drug Amendment of 1962, which specifies that before the FDA approves a drug, the manufacturer should prove that it is safe and effective. Well, you can't prove that it's safe until you've waited for 20 years.
Okay, we'll stop for now, and we'll continue this next week.
Okay.
Thank you very much.
Okay.
We have some addresses if you need further information. Good night.
This program was produced by WNED-TV, which is solely responsible for its content. Major funding was provided by public television stations. Additional support was provided by unrestricted general program grants from the Corporation for Public Broadcasting and the Ford Foundation.